So hey everybody, it's Adam Farkas again, and this time I have a new victim with me here at the Vision Web Uprise booth, Jeff Sonsino. How's it going,
how's
Jeff?
How's it going, Adam? Great to see you.
So Jeff, how's Expo been treating you?
Oh, this has been real fun. I'm kind of in and out at this meeting, but there's so much to see here, and the exhibitor hall is just packed, which is kind of cool.
Yeah, it's an exciting meeting, and I know that the education has really been ramped up here as well over the last several years. So
yeah, they've been doing
really
a great job, especially in the contact lens area.
Yeah, great. So I wanted to just talk a little bit about what's going on out there in the world of legislation, because it's obviously a hot topic. In fact, on ODwire this past week, people are talking about the FTC meeting, and they're talking about online refraction and how it's here already, and you can't escape from it. So I'm curious, what do you think about everything that's been happening?
Oh man, I'll tell you, things are moving at lightning speed. You already mentioned that there was an FTC meeting just recently, a few days ago, March 7th, where the FTC brought together some stakeholders, and it was actually a very interesting meeting. I did not attend myself. I decided to kind of take a step back from it. You know me well, and you know that I'm very, very passionate about this topic, and I thought that if I were there, I would be too emotional about it, and I wanted to not have that emotion in it. So the impression of the meeting, though, was actually pretty positive. There were some detractors from our position there. There was a henchman from 1-800 who was an ophthalmologist. He got on stage and made a comment that an eye exam should take place every 5 years, and that was kind of outrageous. And some of our friends actually stood up for us, and so that the FDA and the CDC and actually organized ophthalmology all stood up and said that that is preposterous.
Right.
So that was kind of a positive that came out of it. The FTC, I think, has to listen to all sides, but I think after this meeting they got a good sense that a contact lens is a Class 2 and Class 3 medical device. It's not a widget that can be just sold willy-nilly without a prescription. I think they also realized that contact lenses cannot be substituted.
Right.
And these are not just positions that the AOA has taken, but these are positions that the FDA and the CDC, both governmental organizations, have taken. And we are a unified front when it comes to that. There was also representation at this FTC meeting from a new group called the Healthcare Alliance for Patient Safety. Are you familiar with this group at all?
I am not really familiar with it, no.
I think, just because it's so new, a lot of optometrists are not familiar with this. But this is probably going to be, aside from the AOA, probably the most important group that's come together in Washington in the last 5 years. The Healthcare Alliance for Patient Safety, of which, full disclosure, I am a board member of, is a group of optometrists and manufacturers and companies that stand for the principle that patient care is the most important factor when it comes to selling devices or medical devices in our industry. And so the doctor-patient relationship has to come first in everything that we do. The Healthcare Alliance for Patient Safety is an advocacy group that is going to be doing a lot of work in Washington, D.C. to change the current narrative that is really being written by companies like 1-800 Contacts and Lens.com and other companies that just really do not respect the doctor-patient relationship.
Right.
And so we are going to go and we're going to go up against that, the message that they're propagating in Washington, that optometrists are not important in this equation.
Right. It's interesting. The argument that is being made by 1-800 is always, it's consumer friendly to have the lowest cost. This is their argument constantly. What is consumer friendly? Consumer friendly is being able to get your product when you want it at the lowest price. And I think that's part of the narrative that the FTC, when they look at most consumer goods, this is what they've traditionally gravitated towards, right? But I think in healthcare, this is obviously not the case. And I don't think that narrative has really been pushed strongly enough to this point. So it's great that groups like this are standing up for the doctor-patient relationship.
Now, I'm really excited about this group because it's not just optometrists and the AOA barking at legislators. It's a unified front of a bunch of different stakeholders which are all concerned about the slide of patient care. Now, the groups that are in the Healthcare Alliance for Patient Safety so far are the American Optometric Association, Johnson & Johnson Vision Care at the highest level. We just got word that VSP joined the Healthcare Alliance for Patient Safety, which I think is a huge statement. Listen, the board members of the APS, we don't all have to get along about everything, right? The AOA has battled VSP in the past on certain issues, but on the issue of patient safety, we are completely aligned.
Right.
Right? Another member of the APS is CooperVision, and so what we are really looking forward is the other major members of industry to jump on board and join this group. What I would challenge the readers is that keep listening and see who joins this board. And really, when you're making your spending decisions in your practice, think about who is there standing up for the profession.
Right.
And which companies have taken a leadership position and are standing up for you. Because we know that there are companies actively trying to insinuate themselves in between you and your patients. And unless a group like the Alliance for Patient Safety, Healthcare Alliance for Patient Safety, stands in their way, they're going to win. And so pay close attention in the next few months to who joins the APS. And those are the companies that you want to support.
Right, and we will be watching closely. So great. So Jeff, thanks so much for this, and I guess we will see you out in cyberspace.
Thanks, Adam. I appreciate it. And thanks to everyone listening.